everyone, and welcome back to Rarely Typical, a podcast where I am talking about living with a chronic illness, finding hope, and living a life that is rarely typical. Today, I am talking to my friend Shanna, and we are going to be talking about the end of all of the clinical trial talk. I wanted to give you guys like a full picture of what clinical trial looked like and not just take my word for it. So I am here today and I just wanted to chat with Shanna. So, hey, Shanna,
Everybody, I'm Shanna.
can you tell us a little bit about yourself?
Yes, yeah. I also have pulmonary arterial hypertension, and it's idiopathic as well, similarly to Jerry. I was diagnosed. Gosh, I don't even know anymore. I stopped counting. I was diagnosed back in October 2019, and yeah, since then I've kind of been on this journey with everybody else that has PAH, but I've been in a number of clinical trials since that time.
So, when I started this whole clinical trial experience, I was like trying to figure out if I wanted to do this, but like obviously I wanted to. And I called Chelsea, and the next person that popped in my mind was Shannon because I knew that she had already participated in a clinical trial. And at the time, I didn't know anybody else that was in one. And I thought I probably should have somebody else's opinion. And so I asked you about your clinical trial experience, and I felt like you helped me decide, like, okay, this is what we're going to do. It's not that hard. It's not the worst thing in the world. And I think in my head, before you and I talked, obviously it was that whole this is like last resort. Am I at the point where I need to be on a clinical trial? And I was so nervous. Like, does this mean I'm at the end, like right before transplant? Are we like at the point where like clinical trial is the only thing I have left? And you had already been in one. And I think at the time you were going into like your second one or something. And I remember thinking, like, she's been in more than one, so I could definitely just do one. Do you remember that conversation?
I do. Yeah, it was, gosh, maybe a few years ago, maybe more than 3 years ago or four. I don't know. But it was right before you got on the sotatercept trial. And I was really trying to get on it, but I didn't, unfortunately. But yeah, I've been on a number of trials since diagnosis. And yeah, you were worried about what the experience was like at that time. And I think I just told you it's just a lot of doctor visits, but every research trial is different. And so it's important to like read everything in the fine print because you're committing to whatever they're asking. Sometimes from all the trials that I've had, some trials require more visits than others, and some require even more extensive testing, like a right heart cath. And some just require, repeat echoes. Some just require blood tests, And so I think being sure that you read everything that's on that fine print and know what you're signing up for before you commit, because that's a big one.
I feel like I obviously did not read anything. You know, they always hand you like that stack of papers, and I was just like, "Oh, it's fine, whatever." My
Yeah,
doctor said it was fine, so I just, ignored it for the
right.
most part.
Okay, so like that too to begin with. But I had an experience in a recent trial where they pulled the research study and supposedly, it could have affected your serotonin levels. And that is responsible, for your brain, not just your body. I think they were looking to like decrease serotonin in your lungs, but we need a certain amount of in our brains as well. And so I kind of wish that I read a little deeper into that one because it's possible, actually likely, that it affected the serotonin in the brain as well. So I lesson learned. Yeah, just be sure to commit to what's on that paper and what you signed your name to. But I think like similarly to what you were saying in that there was kind of a desperation there of wanting to find a way forward for this disease, some type of hope. Because again, at that time when we talked, so Tadalafil wasn't out yet, and when I joined that trial about the serotonin, again, so Tadalafil wasn't out yet, and so yeah, I think I was just very hopeful, but yeah, I've learned some things about clinical trials for sure.
Yeah. So you've been on, what did we say? 4? This is your
I
4th
think
one?
4. Yeah, I'm on one right now too, actually.
So can you go all the way back to the first one, and can you tell
Okay.
us tell
Okay.
us how you found out about it, why you did it, and then what you learned from the first one?
From the very first one. Okay. So that was soon after diagnosis, maybe like a year out. I found out about it from my PH specialist out here in Santa Barbara. And luckily, he's really on top of what the latest research is in PAH. And, he gave me the information on, again, through all those paperworks. I used to do research on Google and just read about the potential research studies that are out, ones that are kind of recruiting. So I was like very into that world for at that time. And so that's how I found out about it. The trial, I'm trying to remember what it was about. I think it was similar to like the prostacyclin drugs that we're on, but just a different type. It was a pill form and it required a ton of pills. I had to take, I don't know, maybe 20 a day. It was insane. I had to yeah, I had to punch out pills like 20 times a day for that one, and it was just the dosing was really weird, but, for that one, I wanna say the tests were not invasive, so it didn't require caths. It required the usual the 6-minute walk tests and occasional EKGs and echoes and lots of blood tests, so you can't be afraid of needles. But that one generally wasn't too difficult. I was able to attend the visits. They require you to be seen more often in the beginning, at least for this trial, and the ones that I've been on, and then they kind of slowly wean you with the visits, and then eventually it's like less and less in-person appointments. And so that one, besides having to punch out 20 to 30 pills a day, um,
I remember those pictures. I think that's how I
yeah,
met you at trial, because you were taking pictures of them, right?
yes, I was, yeah, I was at the time. It was like after COVID or something, I don't know. But yeah, it generally wasn't too bad. I do the fact that with clinical trials, just in general, that you're monitored by your PH specialist more closely. And so that is another reason why I was interested in clinical trial beyond, your 3 to 6 month PH visits.
Yeah, I remember you taking those pictures, which is so funny now that you said that.
Long
Like,
time
all
ago.
of a sudden, it like triggered a memory in my head. You know what I mean?
Yeah.
I actually just said to somebody that I have considered another trial because I like being like, I don't know, closely monitored. Like,
I do.
especially with this disease, right? Like, I liked,
Yes.
I don't know, being like overly cautious as opposed to when I've had a bad experience and not being cautious enough, I guess. Uh,
Correct. Yeah.
so that first trial obviously wasn't terrible because you went back for a second one.
Yeah, and I'm trying to remember why. I think it just got pulled as well. I think the data wasn't showing what they were trying, obviously, to show improvement for PAH. And so that one got pulled. I took a break for a while, tried for another. It's funny because my BNP, I think for that second trial was too low. Like they wanted you to be within a specific range. And so I didn't meet for that one. So yeah, that's how that went.
What did you do for your second trial? Was it pills?
I'm trying to remember. I'm pretty sure it was pills. I think it's only ever been pills, which has been easy in terms of, following through with a program that they're asking. I think the second trial that I was on, that actually got on, because I think there's a process of attempting to get on trials, right? And then you actually getting admitted to a trial. So the second trial that I got admitted to, I think was around the time I actually met you, Jerry, when I saw you in Florida. So that was what, 2 years ago. And then that one was also a pill form, less pills, thankfully. And it was a little easier to kind of incorporate in life because I would just put them with my regular, pill container for the week. And that one was trying to remember. I think it was a drug of, again, the prostacyclin class, but not similar to what is it called? Uptravi, but not. Like it was trying to
Okay.
be like Uptravi. And so honestly, it was easy. And I think for that one though, they did require right heart caths, a lot of them. I had
Okay.
so within a year span of being on the trial, I might have had like 3 to 4 heart caths.
Dang. Okay.
Uh-huh. And I think, yeah, that sounds insane now, right? I think it was probably a year and a half. But I had one on my left side and I had one on my right side. So I think they were looking for specific things. And so that would be one of the more invasive trials. After that, I was like, I don't want to do any more crazy invasive procedures for these trials. I remember telling myself I need to take a break from that because it is a lot, on our bodies. Anytime we go, even under a cath, right? So I took a break and then I got onto the one I'm on now. So maybe it was
3.
more like 3. Yeah. And I tried for 4 or 5, but it took
So you did 2 pill trials, and both trials, were you double blind, or did you know if you were on drug or not?
um
Um,
so I still actually don't know if I ever got drug. I don't think they reveal it until the study's completely over. So, but even for the ones that got pulled, I don't think I ever, not that I know of, I don't think I ever found out. I should probably ask my PH doctor if we ever found out the results, if I was on it or not.
were you ever sick? Like, did you feel sick or anything? Like with pills, if you were on drug, maybe you were nauseous or anything like that?
I don't know. No, not that I can think
No.
of.
Just
No, but
taking sugar pills for
Poss
years?
possible, I mean, with the 20 to 30 pills that I was taking, yes, it's very possible that they were just, sugar pills, and, I mean, with the last one I was on, I think that was the, serotonin drug, related drug, and so, likely I might have had it just because I know that it might have played an effect on me for sure. Just not in, like, the way you would think for pH, if that makes sense. But
Yeah.
but plus I have all these other drugs that I'm taking, so, like, I don't know.
Remind me what you're on now.
So, for the trial or what drugs I'm
No,
on?
just drugs you're on.
Like, hold on, wait. Okay, so I am on it's like, let me get my whole list out. I'm on Tyvaso DPI, so that is the inhaler, this
Uh-huh.
tiny inhaler, not the big one anymore. I'm on Tadalafil and Opsumit, Simad, and Digoxin.
Okay.
D- The Opsumit is actually the trial for the higher dose. So it's to see if most people get, I think it's 10. The regular dose is 10 milligrams, I think. And so the trial that I'm on is to see if the higher dose is more effective. And so I don't know. I don't know if I have it or not.
Inhaled, right?
No, it's a pill form.
You're on another pill trial. You're
Yeah.
starting. Okay.
Yeah,
On a third pill, and you've increased your dose
duh,
of.
yeah. Opsumit,
Okay.
Macitentan.
Okay.
Yeah. So that's what the trial is for now. And
And you're still doing that.
I'm still doing it. Yeah. I think,
And how long have you been in it?
ooh, that's a great question. A long time. Probably over a year now.
Okay.
That
And how
counts.
long is it?
I think it's just ongoing until it ends. It's possible that they might start prescribing higher doses once. this trial's over and it shows hopefully good results. So, you know how like in phase 3, it just keeps going, even if like you're actually in phase 3 probably right now, right? So yeah, you just keep on staying on it because they want to,
Forever.
right? They want to track how you respond in the long term, even when it's in on the market. And so that's why it's like, well, you're good where you're at. You just keep your so tatters. You don't have to charge your
So are
insurance.
you on it for the long term and are you responding to it?
I don't know.
How have your
That's
results been? Or how have your tests been?
I mean, I'm on oh, I'm so sorry, I forgot to mention. Did I say sotatercept for what I'm on right now? Because 'Cause I'm taking
No, you said
sotatercept.
hot summer.
Okay. Yes, I'm
You're
also on
also on Sotatercept? You're on
yes,
like 5 drugs right
I'm
now?
on
Like 6
all the
drugs?
4 pa I
Plus
honest
other stuff.
been I'm just like, give me what I need so that I can function, and be as healthy as possible.
It's
And
fair.
I just got off work, so my brain is kind of not here right now. But so yeah, so I'm on sotatercept. I've been on it since last year, and so I don't know. I think that I'm responding well to sotatercept specifically. My last echo was good. It was normal, yay, and my BNP was also within normal range. So I'm like, so that's why I'm like, I don't know if I'm on it. Does it matter? Because we're doing great. We're doing good right now. So when I was taking the optimate higher dose or blind, I honestly didn't know. Sorry, and prior to the Winrevair, I had no idea, no symptoms, in other words, whether or not I might be on the actual drug. So I don't know if I hope that answers your question.
Sort of.
It
I mean, so you started Sotatercept while you were in trial, right?
right. Yeah.
And so, I mean, yeah, hard to tell whether or not what's making what better, I guess, at this point.
Exactly. Yeah. But for the time that I wasn't on Winrevair yet, I didn't notice a huge difference. And so it's very possible that I have the blind. I don't know. I wish I could say that it was a lot better, but so
Yeah.
we'll see. We'll see.
I mean, I'm glad you're doing better anyway. Forget
Yeah.
all the other stuff. I'm glad you're doing better. My doctor just asked me recently if I was interested in another trial. And I was like, no, maybe. I don't know. Like, maybe. And then I was like, I'm on other meds besides my pH meds to counter whatever, right? But I was like, should I be on another drug? I'm doing so well now, right?
Right.
And so, like, I get it. Like, what is the harm? If I add another drug and I get even more better, like, that's awesome. But then I was also like, I mean, that's a lot of travel. That's a lot of back and forth. That's a lot of tests and all the stuff. But then, just like you said, I like being monitored closely. I like that they are keeping very close tabs because, like, with us, you just never know, right? But I don't know. I'm weighing it back and forth because I can't decide either way. I don't know. Maybe.
Yeah, it's a hard thing because you're doing so well. And well, introducing a new drug, like I mentioned, there is a risk with side effects that we don't know about, which I wish I had kind of taken more serious.
Yeah.
Um, so I understand, yeah, the apprehension of being careful not adding more, especially if you're doing so well already. What we talked about with you being on pump and getting off, it's like, you don't want to mess with a good thing, at least until you and your doctor feel comfortable to do that, right? Because it just takes a certain amount of drugs to help
Yeah.
us to stay healthy and functioning well.
Yeah, we have decreased. I'm thankful, right? Because of clinical trial, I've been able to decrease my pump some. And I definitely am at the point where like we could have a conversation about switching to an oral med. I just don't want to switch to an oral med because I would have to switch to the Orenitram and I've already been on Orenitram and I was so
Oh,
sick. And I just
yeah.
like don't want to do that again. And pump obviously is such a buzzkill, but I feel good and I'm great, like the way I am. So like I think it's just a hard trade for me, because I'm worried that my quality of life was so low on the oral form And, with this clinical trial, the hope would be to get off pump. And I know that there are people that are getting off pump, but the only thing I told my doctor I was willing to do was to go on inhaled, but
Mhm.
my pump dose is way too high to go to
Wow.
inhaled. Right.
So
It's
that's
up in the air, really.
not an option at all?
It's not an option right now, but then we
Okay.
talk about this other clinical trial. Like, if I got on a fifth drug, does this make me better? Can we start talking about coming off pump? I don't know. You know,
Yeah. To be determined.
it's all the stuff that you have to weigh when you are looking at clinical trial, right? And then on top of that, how far are you traveling to clinic?
It's about an hour away. Yeah, it's not too far.
So, like that too, right? Having to travel, you working,
Yeah.
having a husband, having a child, right? Same, like not working, but having a husband, having a child, having children. And
Very.
then we live 2.5 hours from clinic. And that's a lot of
That's
commitment
far.
to decide, right? To decide, yes, I will do the clinical trial. I will also drive 5 hours round trip again. I will also dedicate my body to science again. But then also having to figure out who watches the kids when I'm there. Do I have to stay overnight? All of that stuff. I don't know. Like, I get why people are hesitant, but it obviously has been worth it for me. And now you're
Yeah.
drug that I'm on trial for, I don't know. It's hard to weigh
Sure.
whether or not, you know?
Yeah, that makes sense. I know it's tough, and I think everybody just has to make their own decision that works for themselves in their situations. Because yeah, it is a big time commitment, but also it's of course great for research. As long as you know what you're getting yourself into, that's important as well. Again, taking into consideration all of the potential side effects and being okay if you happen to be the person that has the worst side effect. You know what I'm talking about? And so that's important. Because even with sotatercept, there are bad side effects, right? They're good and then they're not so good. But yeah, weighing like what is the greater benefit to you and seeing if it's worth it.
Yeah, it's just hard, especially because like we have kids. And it's like, okay, like I do this drug and I get better, and that's the best case scenario. But also, just what you said, so tadalafil has like you can get a bleeding disorder. People are having
Okay.
like internal bleeding. Like, I don't want to do that. I have kids. I'm trying to stay alive, but you just never know. And
You never,
so I don't know. You just have to weigh the costs, And sometimes it's worth it. Like, obviously, the data for the trial that I'm on made it worth it. Like, all of the data just looked great. But like with these other new trials coming out, I don't know. And
yeah,
they're so
yeah.
different because they're all on the same pathways that we already have. Like, I was on a new pathway, but like to go on another drug on the same pathway that I'm already taking a drug for is what we're talking about for this new trial. And I'm just like, won't that
Uh,
just make me sicker? Not sicker, but won't the side effects just be worse then? I don't know.
Yeah, I know. The one that I'm mentioning about the serotonin was also a separate, it was a different pathway. And so I was hopeful, but I kind of wish I didn't do it. But it is what it is. You live and learn. And so, that's just the best you can do.
Yeah. And
When,
you can pull out anytime.
yeah. Yes, you can. It's all voluntary too.
Yeah. I was eased. I think my mind was eased because I was able to pull out whenever I wanted to. Like, if it got to be too much with the kids, if it got too much with my schedule or like the driving, I was able to pull out whenever I wanted to. But obviously the benefit has outweighed it. But then, like, thinking about doing another trial, it is really nice because it covers all of my tests. Like, those
Right.
are all free. And
Yes.
then the one that I'm on not pays me, but reimburses me for like mileage and stuff. Are you getting reimbursements and stuff?
Yep. Yeah, I forgot to mention that as well. Yes, I get reimbursed for mileage and I get a stipend as well. So they pay it out maybe twice a year, which is nice.
Oh,
Nice extra, yeah, nice extra cash.
I
So
don't get a stipend.
you better tell the people running the research trial.
I know, right? I don't get a stipend. I do know that there are clinical trials in which you do get a stipend or something, right? The fact that I'm getting free medication is nice. I don't know what it costs. I know that it's expensive. I
Yeah.
don't want to have to deal with commercial until I have to. My trial is ending next year, I think. I've
It
lost
is?
track too.
Oh, wow. So you do
Yeah.
have a date for So
I
Tattersall.
have a end-ish date. I heard
Okay.
maybe that they might push people to stay on just to see what the long term
Right.
looks like.
Yeah.
But I don't know if I'm going to do it. I'm having an issue with testing, right? My
Uh,
hemoglobin's been too high. And because
oh,
of that, I'm
no.
having to drive back and forth instead of being able to take home med. I heard that they might be changing that rule because now that it's on the market, it doesn't have to be like that because you don't have to worry about your hemoglobin because you get it, you know. I- I'm getting hemoglobin tested every 6 weeks. And it's
Oh, wow. Okay.
stable.
Right.
It's not that it's like outrageously high or that it's increasing. It's just stable, but
Okay.
it's a point two or point three above their like accepted hemoglobin level. And so
Ugh.
because of that point two or point three, I'm having to drive back and forth instead of before I was able to take 3 months of it home and only drive up once a quarter. But
Oh,
now I'm
I see.
driving up every 6 weeks.
Yeah, that's tough. That's a lot. I can see why you were thinking about. I was wondering why would you leave if they're paying for this expensive drug, you know? But yeah, that is a lot. So some
Yeah, it's
things
a
to
lot because it's a lot of driving.
yeah,
To be
yeah,
honest,
that's a lot for your life.
if I could do the blood test here, or if I could do the blood test here and they could just ship it to me, but they want me there and I have to pick it up myself from the clinic. And then I have to do that every 6 weeks. So it's just, you let me do it for this many months. And now you're like, oh, just kidding. So it's a lot. But then all of
Right.
that compounded on, do I want to do another round of new testing, another round of now driving back and forth again? I don't know. Me and my husband were talking about it, and it was just
Right.
like, well, you're already doing it, right? I'm already doing it. If I went on a new trial, is it really that much different than what I'm doing now? No, but do I want to keep doing what I'm doing now? I don't know.
Yeah, yeah, you have to weigh that out. And also no guarantees if you get on the new one as well. So
Yeah, that's true.
lots to think about. Lots to think
Yeah.
about. And looking into what kinds of tests that they require as well in that
Yeah.
future drug or other drug. Do you know what it is by chance?
I can't remember. I actually was in Denver this weekend. And my doctor from Denver was asking which one they wanted to get me on, but he was naming them and they didn't sound familiar. So I don't know. I'd have to
Okay.
ask Moss, to be honest. I'll
Okay.
ask him.
Or if it's like pill
Um,
form or inhaled form or anything
I
like that.
think it's a pill form,
Okay.
but in my head, I feel like it was another injection. But I'm like vaguely recalling it might have been a pill. We've had multiple conversations. So I'm trying to
Okay.
recall which conversation it was.
Yeah.
But we did talk about a pill at one point, and I was like, I don't want to add any more to my digestive tract at this point. And then we did talk about an injection at one point, and I don't know if that was this one or not, but I was also like, I'm already getting two injections. I'm getting the sotatercept injection, and then I'm doing the Dupixent injection for my skin. And I'm just so tired of injecting myself. Do I want to also add another injection? So I don't know. None of them sound appealing either
No.
way, really.
I mean, one and done at least forever, however long it lasts for, which is nice.
Yeah,
So
that's true.
that is a lot of needles. A lot
It's
of
a
needles.
lot of needles.
So
My
things to
poor
consider.
stomach.
Oh, I know, I bet. Yeah, I just got used to doing the sotatercept injections too, so it's not so bad. It's not so bad
It's
after you've done.
not too bad. It's just really, it just burns when it goes in. But then after that, it's not really bad. Are you getting nosebleeds?
So I used to get nosebleeds more often and intense, but since my doctor, I think I was having a high hemoglobin issue too. He lowered my dose to starting dose, and it's been pretty good since then.
Oh, good.
So when I do get them, they're very like mild, very scant, and easy to manage. Versus before, it would take like at least 5 minutes to stop, maybe less than that. But it was annoying for sure because when I'm working or when I was working, especially like with patients, it's not nice. It's so inconvenient to have a bloody nose when you're in the middle of something. I think this is what got to him. I told him I had to put like a tissue underneath my mask and excuse myself away from patients to deal with the bloody nose situation. And I think he was like, okay, try lowering the dose. He kind of looked at the calculations again with the body weight and so forth, because they have to do that. And so that's what kind of led to me getting on back on starter dose. So if that's possible for you, talk to your doctor about it. I think it's helped a lot for sure. Like just manage the symptoms.
I feel like after a while, the nosebleeds have gotten better, but then every time I say that, I get a really bad nosebleed. So I don't know. Most of the time, I notice that the nosebleeds are the heaviest right after I do my injection, which is super funny though, because when I started clinical trial, they told me that bleeding was an issue, but they didn't say nosebleeds. I don't think. I don't remember a conversation about nosebleeds. And then I was like, what's happening?
Oh no. Yeah, I remember seeing
Yeah.
pictures. And I was like, And then I started getting them too. And I was hearing a lot of people getting them as well. I'm like, oh no. The scariest incident I had was, or I wouldn't say scary, it was kind of odd, but I had a puncture wound on my thumb and it just wouldn't stop bleeding. It was crazy. I was like, that was so odd. It took a very long time and it would just keep reopening. And so I think that was another a thing that made my doctor like, okay, let's look at this again. Because that is a very odd symptom.
I feel like I was just talking to them about clinical trials. So I'm on trial. So like whenever I have something come up, I have to tell them. And so I've noticed a lot of weight gain
Yes.
and not a lot. Like I've noticed, I think I gained like 10 solid pounds. And then I've been getting like a lot of acne. And so that has been an overarching issue for a lot of people.
Yeah,
And it's not part of their side effects.
of course not.
And I mentioned it. I did too at my last appointment. And she was like, oh, I don't think that that's a side effect that's listed. And I said, probably should tell them to list it.
Right. I did tell my doctor that too. And he said the same thing. That's not a known side effect. And I was like, well, if it affects your infertility, of course, it affects your hormones. And then, of course, it's going to affect all the other things like weight gain and periods that are being missed. And so, of course, it's just got on to the market. So there are going to be things that aren't established until it's studied for a longer period of time. So maybe it's a good thing you stay on the trial. But yeah,
I
I'm
know.
here. A lot of people are having issues. A lot of women, particularly, are having issues with weight gain and acne as well. Same. And so that's not the fun part of new drugs, but again, it's worth it, right? It's like weighing
Yeah.
weighing what's better for you, what's manageable.
It's such a weird, the acne is honestly like the weirdest side effect. And I will take acne for a fully functioning heart. However, it's not fun and it's also not cute. You know what I mean?
So not cute.
But it's also funny because I am part of the people making this list of side effects. And I'm just like, that's no pressure, right? So that when they ask me if I have something,
Right.
I don't know, is there something different? I have to really think about it because
Mhm.
if I don't say something, right, and it doesn't get written down, then I feel weird because somebody else said, oh, well, I had the same thing, you know? So
Oh,
part of
yeah.
clinical style.
Yeah, that makes sense. Yeah, you better tell them. Hopefully, they'll have enough data to actually establish it on their little pamphlets, right? Because again, in our little So Chatter Set group on Facebook, tons of women are having that issue. So it's so weird, right? How that's
So weird.
not a known side effect.
Yes. Okay. So thank you everybody for listening. I hope that you guys got something out of this. Shannon and I could obviously, just like me and Chelsea, could just sit here and talk all day. So
All right.
we are going to cap this episode. But before we go, do you have any parting words?
Yeah, I think it's definitely something to look into if you have PH. Just be sure that you know what you're getting yourself into. read all the side effects and see if it works with your lifestyle, like me and Jerry were mentioning, because there is a commitment on your part. You do have to drive out. There are sometimes invasive testing. On the upside, there are things constant or repeated monitoring from your doctor, which is super helpful, and potentially feeling better for drugs that are not even on the market yet, or a condition that still doesn't quite have a cure, right? They don't call it a cure yet, right, Jerry? So Dad said,
Yeah.
no, yeah, not a cure yet. So yeah, thank you so much for having me.
Thank you for talking to me about your experience. And also thank you for getting me on clinical trial because here we are
Of
years and
course.
later. Full circle moment right here.
Oh, yes, absolutely. Of course.
Okay, bye guys. Thanks for listening. And if you like this episode, please subscribe.